we need to start by asking what second pillar means and why your discoveries in this field are so alarming.
Sure, and thanks, James. So the issue here is about this distinction between Pillar 1 and Pillar 2. So Pillar 1 testing is the testing that's done in a healthcare setting, so for people who've presented at hospital or for NHS staff, for example. Pillar 2 is let's say the sort of wider public testing. So for anyone who's been to a drive-through testing centre or had a testing kit sent to them at home for them to return. And this is for people who are testing to see whether they have COVID now, not the antibody tests. That is Pillar 2. And the key issue here is that Pillar 2 testing, that general public testing, now accounts for between 80 and 95% of testing, depending on where you are in the country.
And that figure is staggering because it means that the local authority level publication of figures could be missing out that level of test. As many as 90% of new cases will be missing from the data that the local authorities are working with. So suddenly the confusion in Leicester makes a lot more sense.
Exactly. And one thing I think we need to make clear here is that this data, it does exist somewhere. So the Public Health England and the regional bodies of PHE do have this data for individual local authorities, including the Pillar 2 data. But the problem is, it's really it's not. That doesn't necessarily mean that local mayors, local councillors, and local MPs have that data. And I've spoken to people at Public Health England who say that it really comes down to how well joined up the different departments are in any given area.
And that is why, again, not to labour the point, because it is deeply, deeply disturbing, more than 90% of new cases in Leicester recently would be under Pillar 2, and yet these numbers are not public. So if you've got a business in Leicester, as you say, and I urge everybody to follow you on Twitter, at John Burn-Murdoch, and to dig in particularly to this thread, as you point out, if you're a local business in Leicester, you're seeing a small percentage of the picture.
Exactly. We've seen the confusion this has caused. There was almost the reverse situation yesterday in Doncaster in Yorkshire, where there was a lot of concern that Doncaster might be the next Leicester, as it were, because the data that the government has been putting out showed that Doncaster had the second most alarming record in terms of new cases. But again, that was only Pillar 1, and so that led the Doncaster Director of Public Health to actually have to come out and say, look, when we take the Pillar 2 and Pillar 1 data, the numbers are actually relatively low and falling. So whether it's causing people to be too relaxed or people to be too alarmed, it's just causing these huge problems everywhere, and no one knows whether they can trust the numbers they're seeing.
And that's the fundamental problem, especially with Saturday looming on the horizon, and people more and more being encouraged to make individual choices or individual judgments on what they should and shouldn't be doing without the information they need to make an informed choice.